I find there's a lot of anemia. A lot of women are iron deficient. They're not eating enough protein. They're not getting the right protein combining. Then protein's the building blocks of embryos. And I will just get patients to send me photos, do a food diary, because I want to see what's going in your mouth at every part of the day. And that includes hydration, because how many people I look at their tongue, it's a geographical map of what's going on in your body. I will see people's tongues, especially entrepreneurs, and then you can see all these cracks and crevices, almost like if you're looking at an aerial of the Grand Canyon, you see the crevices and the deep fissures in the tongue. We call this yin deficiency.
Hi, Dr. Fiona. Welcome to the show.
Thank you, Mark. It's a pleasure to be here. Thank you for joining me.
Absolutely. I am super excited for you to be here. Welcome to Peak Performance Perspectives, where we help entrepreneurs master health, wealth, and relationships. I have to start out by asking, what does peak performance mean to you?
When I think about peak performance, I'm always going to relate it to fertility because that's the niche that I work in. And so it's about, for me, when I'm working with couples and they're trying to conceive, it's getting people their physical best, their mental best, their emotional best. And there's so many layers to that. But basically, it's just working at your optimal performance in all of those areas. That's how I would consider peak performance with a fertility slant.
I love it. Let me ask you first a question that is pretty much a conventional thought in most people's mind, where they think that if a woman is over 40, it's not possible to get pregnant anymore. What would you say is the main difference between your preconception method versus, let's say, a traditional IVF treatment that usually women go for after they're 40?
The difference is that you just go straight into an IVF cycle. There's not a lot of preconception care apart from a couple of contact points where they will say, here are some supplements. There you go. Your cycle starts in 2 weeks. They might do the bloods, get a base marker. Whereas for me, the way that I do the preconception, I actually want to see you 3 to 6 months before you go into a cycle. Understanding that your egg quality, you can improve that every 3 months. Right? Same as sperm quality. It regenerates every 90 days. So I need to catch you 3 to 6 months so we can optimize and we can actually change the parameters of sperm. We can improve things because often when people come to see me, we've got male factor infertility, and that's where they will ICSI the sperm and they will do these things. But why not get it optimal? Why not get the best DNA possible for this conception and do the work 3 to 6 months beforehand? So that's where it differs working with me, is that I actually prepare your body for pregnancy. And that means getting the lining right, getting your egg quality, because here it is. If you look at your egg quality, they're primordial. Your eggs are primordial. And it's not until they start to go into the internal environment that we need to see what's happening there. What is your sleep? What is your hydration? We want that optimal environment, because if the environment's not optimal, it's not even going to work if you're going to do IVF. So we need to get everything optimal, that internal environment. So that difference between IVF and me is that I actually prepare you. And so I actually do have people that come to see me and I prepare them for an IVF cycle. We actually do the work. So then we will minimize the amount of rounds that they might do IVF. So I guess that's the key difference, is it's the prep phase.
I think this is a great conversation to be had because there are so many female entrepreneurs that I run into who have another baby, which is their business. And they have taken so much time to raise their first baby that sometimes they're feeling like, oh my gosh, I've missed the boat on having a biological child. And sometimes they don't want to go through such invasive treatments like IVF. So the fact that you exist and what you offer is so unique and important. I really love it. Let me ask you this question. You mentioned IVF, in this case, isn't always increasing the chances of conception, right? Because of all these other factors you mentioned. Why do you believe this is often overlooked in the fertility industry?
Because we don't have time. We're all in a hurry, okay? And I always say to everybody that might be listening here, the best possible advice I can give you is give yourself time, quality time to actually fix things. And so go into it understanding that you give yourself at least 3 to 6 months, or give yourself 90 days. It's only 12 weeks. It's not a lot of time. This is the key takeaway. If you get your body ready, and this is where I say when you're healthy and ready, your body's naturally fertile. Now, that's going to increase your chances tenfold. Whether you're going natural conception or IVF assisted, you've got the best possible outcome.
How does one go about getting their body ready?
These are the lifestyle parameters, and it's a bit of a tidy up, but it's the basics. I think the biggest thing is sleep with entrepreneurs. They don't sleep enough. And you've got to remember that sleep is like one of the greatest pillars I teach my patients. Sleep quality, getting to bed before midnight, like around 10, lights out at 10, asleep before midnight. Every hour before midnight is equal to 2 hours of real time sleep. And if we look at liver detoxification, it happens between 1 and 3 a.m. Now, I have so many entrepreneurs that I work with, and they're awake at 1, sometimes getting to bed at 2. And I'm like, that's the first thing we need to fix is the sleep. All right. That's the first thing. And then the nutrition it's Chinese medicine. What I love about Chinese medicine, it doesn't go this diet, that diet, it's Chinese medicine is all inclusive. It's just about understanding how to eat the right portions, the right macronutrients, so that we get nature's variety and we eat the best version of it. So if we're eating nuts, for example, it's not like I say, all right, have 500 grams of nuts, because nuts and seeds are great, omegas, right, for fertility. We want to make sure it's about 30 grams. Like too much of anything is not optimal. So when I teach people about nutrition, I teach people about nourishment. And I get people to understand, just look at the basics of your stomach. It's like your two fists here, right? Join them together. That's the size of your stomach. So let's just not, sometimes I will get my patients to put their hand on the plate and I will get to see what's on the plate. So I say, let's just get the breakdown. Macronutrients. So what are they? Protein, carbs, fats, micronutrients, nature's rainbow, and we just do that and get diversity. So I'm looking for a diversity of foods, not the same foods all the time, because your biome is so integral for fertility and it loves diversity. We need lots of fiber. We need lots of things to mulch, probiotics, prebiotics, and we want to make sure that you have 30 different foods that you consume in your mouth over the course of a week. So that way, then it doesn't feel so restricted. And I'm not saying carnivore, anti-inflammatory. It's just no. When you start to restrict people, they become rebellious. I try to take the word diet out and I bring nourishment in. Nourishment, warmth, nutrition, support. It's like a reframe on the subconscious mind.
When you restrict people, they get rebellious. And then the idea of nourishment over nutrition. I love it. I love where this is going. You mentioned how you incorporate Chinese medicine, and you touched a little bit upon how different it is from the conventional practices. What can you give some other examples of roles Chinese medicine plays in fertility specifically, and how it differs from the Western approaches?
Yeah, it's in its simplicity, it's about homeostasis. It's about finding the balance. If I'm working with patients, and a lot of the time I'm working with patients that have a lot of inflammation, a lot of inflammatory symptoms or immune. So Chinese medicine is very simple in its approach. So what do we do with inflammation? We cool it down. So if we've got some fire and heat in the liver, then I will give you like bitter and cooling foods or a liver supporting protocol, like lots of leafy greens, dandelion greens, broccoli sprouts. All of these things cool you down. So in its simplicity, it's working with those elements, and we try and work out, where are you deficient? It might be, oh my gosh, especially with fertility, I find there's a lot of anemia. A lot of women are iron deficient. They're not eating enough protein. They're not getting the right protein combining. Then protein's the building blocks of embryos. And I will just get patients to send me photos, do a food diary, because I want to see what's going in your mouth at every part of the day. And that includes hydration, because how many people, I look at their tongue. In Chinese medicine, we use tongue diagnosis. So it's a geographical map of what's going on in your body. And I will see people's tongues, especially entrepreneurs. They tend to not drink enough water. And then you can see all these cracks and crevices, almost like if you're looking at an aerial of the Grand Canyon, you see the crevices and the deep fissures in the tongue. We call this yin deficiency. All we need is to use some electrolytes. Coconut water is very hydrating. Use some hydrating fruits like watermelon. So you see, with Chinese medicine, I love its approach because it's basic and it's easy to understand. It's difficult to diagnose, which is why you need a good practitioner to give you your differential diagnosis. But once you know what your diagnosis is, it's easy to treat. That's the beauty of it.
First of all, I have to be careful during the podcast to not show you my tongue, because all my secrets would be out.
That's
but on
right.
another note, there are so many people who have autoimmune conditions or gut issues, and they cannot eat a specific type of food or sometimes a category of food. On the other
That's right.
hand, there are also people who have dietary preferences. A lot of people are vegan and vegetarian. How do you go about navigating those types of dietary requirements when you're working with them?
Yeah, and look, I work with different cultures. Like people might not eat pork if they're Jewish or shellfish. I'm always optimizing. That's the beauty of Chinese medicine. We can optimize. If you have religious restrictions or if you're vegan, then I'm going to make sure your protein combining is great, that you are combining your grains with your pulses and we're getting complete proteins. Or I'm adding in quinoa because it's a complete protein. All right. So I will always work with where they're at. You know what I mean? But if someone is seriously anemic and their ferritin is really low, I might even try and incorporate some beef liver capsules. And if there's no ethical consideration, it's really important if we can just get them to take a little bit of beef liver capsules and swallow them. It's incredible because it's better than taking iron tablets, beef liver. It's incredible for building up the iron stores and that ferritin. That's the part of being what I do as a practitioner is being able to optimize what they need based on their needs and their beliefs.
We started off our conversation with a misconception, right? What are some other misconceptions women have, especially when it comes to natural conception after?
Okay, this is the biggest one. I've got low AMH and high H, and I've been told I'm too old and I need donor eggs. Biggest misconception. And so they come to me and they're like, my AM is so low, I'm going to need donor eggs. And the stress the women are under when they get told this AMH level. And this is the biggest myth in the industry because the AMH it's a marker and primarily it's an IVF marker. It's to determine how your body will respond to the IVF stimulating drugs. It's not a marker of your ability to get pregnant naturally. So when women come to see me and they want to conceive naturally and they've got an AMH of 1 or 0, I say, don't worry. Do you have a regular cycle? Yes, I have a regular cycle. Then you are ovulating an egg every month. All right. And what we need to do is make sure that we have that quality there. So we work on that phase of making sure that it's the best egg possible. Because really, under normal circumstances, we're only releasing 1 egg. I only need 1 good one. I don't need 15 when I'm doing natural conception. Do you know what I mean? So that's the big thing. I say to people, throw out the AM marker. I really feel the big pharma, the medical industry has done women a disservice with that AMH marker because it's not a marker of your egg quality. There's no marker for egg quality. The only way for you to actually test an egg is to fertilize it and then do the genetic testing. That's the only marker. AMH is not a marker of your egg quality. So I think that's the biggest myth. And I think that's the biggest takeaway from our conversation today. I want to empower women, even over 40. Your egg quality, it's all determined by your lifestyle factors. Let's get those right. Your sleep, your stress, your hydration, your relationship intimacy, your spirituality, your connection to the divine or God or whatever, however you want to call it. But even if it's just like, how do you empower yourself? Are you in a place of safety and satiety? Yeah, we work on that.
What are some of the most common reproductive health conditions you treat? For example, there is PCOS, there is endometriosis. How do you approach these holistically?
Yeah, look, both of those markers, yeah, they're very common. So it's largely a metabolic disorder with all these hormonal implications. So there's so many tiers working with PCOS. We've got to work out what type of PCOS you have. Part of it is getting the microbiome, right? So often there's leaky gut, insulin resistance, androgen dominance. We fix all of those things. So you can use supplements like myo-inositol to lower androgens. We work on glutamine and probiotics to get the gut right and get like I talk about, I might do a gut healing protocol. Well, I get them to eat warm, cooked foods, things that are easy to digest. So PCOS, and then the stress, right, with PCOS, because it's stress on the body. And it's important that they get good quality sleep around 8 to 9 hours. And yeah, and then it's just time on feet, not restricting. The thing with PCOS is the first thing they want to do, because there's a lot of weight gain often, not always, but often, is they want to restrict. And that's where I have to help them cognitively and do the reframe. No, it's about nourishment. So I get them to do the portion sizing and the plate and make sure that they've got the good quality protein and all the macros, all the building blocks And so PCOS, I have great success with that. Endometriosis is largely an inflammatory disorder. I will often looking at how do we decrease inflammation, because that's one of the key drivers with endometriosis and adenomyosis. So we'll look at things like an anti-inflammatory diet, and I will just pull out things that are hot and spicy. A lot of these people with endometriosis, they tend to do all the wrong things. So they eat a lot of gluten and dairy and sugar. And I'm like, these are the key things that we remove with that because they're inflammatory. Okay. So just by removing those three things. And then I have a lot of patients that have endometriosis and they go, I'm into my smoothies, and I'm like, oh, these are very cold and raw. And so what it does energetically, it creates blood stagnation. And that's characteristic of what we have with endometriosis. There's a lot of blood stagnation and pain. And so the worst thing someone with endo could be doing is having smoothies in the morning. So I do a reframe and I will get them to, let's make a scrambled eggs and spinach or a saute or change it up. Have a warm porridge with some cinnamon. We start to change things. So the energetics change when you actually know how to treat those patterns. But there are two key things that show up in the clinic. Autoimmune is another one, like Hashimoto's. I would say Hashimoto's thyroiditis is probably every second client has some autoimmune thing going on. All right, a lot of levothyroxine. So I'll do like a Hashi's protocol with them. And it's really I might start with removing the gluten and the dairy. So they're two key things that I'll do when I'm working with Hashi's and work a lot on their gut. Because the microbiome, even with these three conditions that I might treat, in the clinic, the central, like the key drivers is when there's gut dysbiosis. So it's all about the gut and getting that micro solid moving forward. But they're probably the key three things that I would find in clinic. Then it's the balance of the ratio of progesterone and estrogen. That balance tends to change as after 40, we tend to find as we go into that perimenopause phase, which is from anywhere from 35 onwards, things start to change hormonally. So it's about balancing the hormones. And I love using Chinese medicine and acupuncture. Like these are two things that I find so good when there's just that little hormonal imbalance of estrogen versus progesterone. We might have estrogen dominance, particularly if you've got endometriosis, there's a lot of estrogen dominance. So Chinese medicine is amazing for balancing that out. And we use moxibustion, like heat therapy. This is where we put moxa, little cones, heat cones on the ends of the needles. And it's powerful for moving that blood stasis. It's really amazing. But they're the key things that I would see. The other big thing that I have, and this is the thing that's less talked about, see how we've been focusing on the women? Male factor infertility has now become really integral in my work. I'm treating more male factor infertility. So we're seeing declining sperm counts. We're seeing like the morphology, the motility. It's not great. Back when I first started practicing Chinese medicine in the early 2000s, we used to see morphology up around 30 to 50%. Now the WHO considers normal morphology now from 2012 onwards at 4% normal, which means 96% is defective. Now, that morphology is the sperm shape. So that's actually what pierces the granulosa cell. And so if you think, I only got 4 out of 100, right, that means 96%, that's a fail, isn't it? That's not good sperm, but IVF will take you at 4%. And so when I have patients that cross me, I say to my patients, if we get the sperm right, because it's regenerating every 3 months. So I always cite the semen analysis first, because it's usually the males I have to work on. Now, I've just had a patient recently. She came to see me. We did a 12-week program. Husband was quite reluctant to do the semen analysis. Oh, I had one in 2022 and I'll get it to you. I haven't found someone. And it was this delay. Finished the 12-week program. Last week of the 12-week program, we get the semen analysis and it's quite poor. And so had I had that 12 weeks earlier, I could have fixed that. You see why I start with this? There's that beautiful Rebecca Fett. I love her book. It starts with the egg. I want to say, no, it starts with the sperm. It starts with the sperm. So ladies out there, stop blaming yourself. Part of this is a 50-50 split. You've got to remember that the DNA is coming from the male and the female. So check out the semen analysis. Do that. That's the first parameter we want to check, even if you're doing IVF.
Whether someone is trying to have their first child or fifth child, the lack of ability to conceive is stressful mentally. How do you help women build confidence in their body's natural ability to conceive, even after multiple miscarriages and other fertility challenges?
Because I work with data. So when I work with patients, I show them the data. I take pictures every week of their tongue. All right. I show them this is where we started and they can see the changes. When you've got data to show people, and then if on the BBD chart where they might not have been ovulating, they might have had an anovulatory cycle. And so all of a sudden we start to get them ovulating and they can see it on the chart. All right. So I'm very data focused when I'm working with patients. And then I'll say, look at your food diary back when we first started. And I'm like, do you see all those processed sugars? There was no protein or folate on that plate. And they're like, yeah, it's amazing. Like most of my patients become master chefs after working with me because I'm giving them recipes, cookbooks. And part of it is that's how you empower people, because when they can see the results, and then they can observe their fertile signs. Like part of it is just awareness. And I'm an educator. So I teach people, how do I know when I'm ovulating? I teach them about the fertile zone, the windows, the cervical mucus, the cervical height to know how to work on your cervical height. If it's high, right, the cervix, it goes up and down like this. The cervix goes high and low. When it's high, you're ready to have sex because it's like the penis can slide in. It's ready to go. When it's low, you're about to menstruate. If your cervix height's high, we're good to go. And we've got that lovely egg white sticky mucus. So I teach people these fertile signs. And when they start to see and observe them and they feel that nourishment, and I also get them to believe in the power of their body. Now, I do this by inward reflection. Like I get my patients to actually start to go inside, not project outside. Because I find with a lot of entrepreneurs, they're always looking forward, the next big project, what's next, but they don't often look in. So I get them to do just even some subtle, so coherence, hand, skin to skin, hand on heart, skin to skin, hand on the womb space at night. And I get them to feel their bodies, feel their bellies, connect to their womb space, connect their heart to their womb space, and just do this rhythmical breathing. Now that alone turns on the parasympathetic nervous system. And we know for entrepreneurs that they're under stress all the time. And the body's always going to prioritize the cortisol, the stress over the hormones. So the more I can teach people how to turn on your parasympathetic nervous system, and I use this through breath control. I teach a lot of breathing techniques. I have a background in yoga. I'm a yoga instructor. And so pranayama is breathing exercises using the breath. The prana is the life force. And so I teach my patients, and I think they think, oh, this doctor is woo. But I'm like, no, wait for it. Wait for it. Like I was teaching a patient Veloma 1 the other day. All right. Veloma 1 is this interrupted breathing. Inhale, pause, inhale, pause. And I get them to place their hand on the lower belly. Breathe into it, pause. Breathe into the diaphragm, pause. Breathe into the apex of the lung, pause, and then we exhale the breath. I had this attorney doing this with me, and I was watching her like I'm watching you now, and she's doing the breath. We did 5 rounds really quickly, not even a minute. 5 rounds, and all of a sudden her eyes glazed over. She went, whoa, I feel different. And I said, you look different. She's like, wow, this is like Valium. I said, yeah, herbal Valium, but good for you, not addictive.
Wow. Wow. So much information here. I want to go back to something you said. You mentioned acupuncture and Chinese herbal medicine. You are using them to address a lot of hormonal imbalance and even adrenal fatigue. So can you tell us a little bit about how you do that?
Yeah. So if you look at acupuncture, I love acupuncture. I started with acupuncture in my training, and then I did my master's in Chinese herb. But the acupuncture, it's what changed my life. I could not understand. I had a bulging disc, really bad injury, back injury. I could not understand how these fine needles could correct a posterior bulge in 2 weeks with acupuncture. How is this possible? Because I had the x-ray scans going, here's the x-ray, there's the bulge, 2 weeks later, gone. And this is just with the acupuncture. Now, these acupuncture needles, I got fascinated by it. It's a conductor. Metal is a conductor of energy. And part of it is that when you're unbalanced, when you're unshed, we all know when we're stressed or triggered. And this is the beauty of the acupuncture. You put the needle in, it's a conductor of the energy, and it turns on your parasympathetic nervous system. Just by putting a needle in the skin, instantly it's turned on. But then we go on the energetics, all right? Just say you come to see me for male factor infertility. You may have something like poor circulation or a lot of internal cold. And we will use the acupuncture needles on certain points to warm you up. We call these kidney yang nourishing points, like kidney 7, or just below the abdomen on the midline, just below the belly button, Ren 4. It's the conception vessel. It warms that area, and you can feel the change in the pulse. You can see the warmth come into the skin, right? Especially if we're putting moxa on the ends of the needles, they start to go, oh, I actually feel warm now. And this can happen in the course of 40 minutes of doing the acupuncture. So the change is quite immediate. And if someone's really stressed, for example, my entrepreneurs and my high flyers, they come in and they're really wound up. I will put in a point, like I love Shen, this point here. It calms the mind, calms the liver, calms the stress, and Yin Tang calms the mind. So I'll put these 2 points in. Often what happens is that they fall asleep or they burst into tears and then they fall asleep. And it's immediate. Like in 5 minutes, I can shift the energy in 5 minutes with the acupuncture. The herbs. Then if we look at the herbs are amazing. Like I look at the lineage of Chinese medicine, 5,000 years of lineage, as opposed to Western medicine. We've got 200 years. There's not a, if you compare the comparison, this is 5,000 years of trialing and testing things that work harmoniously together. So when we're blending the herbs together, we make herbs based on your pathology, or we call it your differential diagnosis. If you had inflammation, I would use cooling herbs, bitter herbs, things that will calm you down. And people will take the herbs. I usually would do them over a period of a month. All right. You can do them every 2 weeks or over a period of a month. Often when I'm prescribing herbs for people in the US, I'll send them a batch of herbs for the month. But the changes I can see in the tongue, like if we're clearing inflammation, the tongue will all of a sudden, the redness will come out of the tip just by 2 weeks on the herbs. And they're sleeping better. And they're like, wow, which is why I take a lot of notes on you. Like I know everything about you, from how you urinate, when you poop, how often you poop, when you go to sleep, when you're making love to your partner, what the intimacy is, and all these things. I see it change just by prescribing the Chinese herbs and doing the acupuncture. And then I would teach my patients the acupressure points, because the more you can empower patients to do it at home. So these points that I showed you, Xing and Yin Tang, like I will get them to tap these points if they are feeling stressed, or they can massage them for about 30 seconds to a minute, and they can feel the difference. I even have an EFT. You've probably heard of EFT tapping, emotional freedom technique. This is based on the acupuncture meridians. All these points are acupuncture points. This is Ba Hui, do 20, Yin Tang, Tai Yang, stomach 3. We go to kidney 27, lung 1, Ren 7, heart 7. All of these points, this EFT tapping is coined from acupuncture. This is acupuncture in action.
Wow. I did not know that. I knew about EFT. I did not know it's a derivative of acupuncture. That's very interesting to know.
Yeah.
We talked about how the fertility journey is so difficult for a woman, but it's also difficult for couples together. How do you help couples who are feeling isolated and overwhelmed by the fertility process reconnect and regain hope?
Yeah, I love Tantra, and I think the word scares people. But the word Tantra is about union. It's about coming back together. And so people think Tantra is all about sex. No, Tantra is about love and intimacy. So what I get couples to do, and I try and leave that word out of the lingo because people get afraid of that word. So I will say, let's have some more quality time and physical touch. It could be melting hugs. Let's start with 8 melting hugs a day, where you really, about 20 seconds of not just a tap and a hold, no, 20 seconds a hold. Let your bodies meet. And then can you have quality time where you're soul gazing with each other? I'm not soul gaze, like really looking into each other's eyes, really listening. It's like, I don't know if you know the book by Dr. Gary Chapman, The 5 Languages of Love. I really love this book because we all have our love language, whether it's words of affirmation, quality time, gift giving, acts of service. It's about finding out what each other's love language is, and then acting on it and filling each other's cup. So we start with the little things, date nights, all right? And then it might be, all right, we might pull back the conversation of talking about fertility all the time. So we actually just park it. We only talk about it on a Wednesday, all right? Because it can just fill up the conversation all the time. And there's more to life than just this fertility thing. There's a relationship here. And I think that we get lost in the process, and it's about bringing back the love and intimacy. So I always encourage my patients, tell me about when you first met. What was some of the first dates you had? And we resurrect those dates. because date night is fun. It's fun. We've got to have the fun. And it's, if we're looking at sex and intimacy, I take ovulation out of the vocabulary because that word scares men. Men just feel like they're being used for their sperm. Men want to be desired. At the end of the day, that's all they want. When we know where the fertile zone and the fertile window is, do not mention the word ovulation because the sperm starts running the other way. It goes backwards and then it goes sideways and all the tails get coiled because they're like, oh, I'm confused. Yeah. So I'm like, let's just take the pressure off the men because they're sensitive too. Men get performance anxiety. They feel like the load's on them. They don't want to let their partner down. So let's not mention the word ovulation. Let's turn on the love language. So if your partner's love language is physical touch, then it's like, all right, start stroking his ears. Oh, darling, I've just have a melting hug, lie with each other, that sort of thing, holding hands. And the intimacy starts to evolve organically, that it's not just I'm ovulating and we have to do this. That's not how we work as humans. We've got to bring the romance back. So let's watch Pretty Woman. Let's have those dates.
What about people who have trouble with intimacy? They're in
Yeah.
long-lasting relationships, but for whatever reason, they're having trouble with that. How would you go about addressing those issues?
Yeah, you know what? I really love sending off my patients to sexologists. And I have some of the most amazing sexologists who are experts in this field of reconnection. And they do lots of incredible things like teaching them a yoni massage, teaching your partner how to massage each other's genitals. Like these are some of the exercises I hear from my patients who have gone to see the sexologist. And all of a sudden, their sex life just comes back online. They're trying new things. They're doing a workshop together. It might be, they call it a lingam massage or a yoni massage, like these things that they learn. And it's just going into it with an open mind. But you can bring it back. And why not see experts if there is love and intimacy issues? I'm a doctor, but I'm not a sexologist. I can coach you. I can make suggestions. But seeing an expert in this field, I'm all for it. And I think we need to open up that conversation.
What role does emotional readiness play in preparing for pregnancy? And how do you assess this with your patients when they start with you?
I might do some coaching and we will navigate the path of change, all right? This is just a cognitive thing that I do with my patients. It might be halfway through the course and we will say, all right, where are we on the journey here? If we look at both of you, we've done the preconception. We've really started to we've got the pillars in place. We understand our weaknesses, our strengths. We're committed day in, day out. They're following the morning ritual, the nighttime rituals. They're committed to the process. And it's an accountability and accessibility. Like, where are you in this line? Have you started your preconception? Have you got your bloods and done all your labs? And are you resisting? So where are you on this accountability scale? Like that male patient that took him 12 weeks to get me the semen analysis. So his readiness, he wasn't ready. But now that he's got that, he's now ready. He's now ready to do the work. So sometimes this is where it's time. You've got to give yourself time. The women tend to come into this very ready. I don't think the men are ever really emotionally ready for this. They go along for the ride often. Yeah. And so part of it with the women is that they lead by example. And I find that them doing the work and they see their partner feeling better, sleeping better, more receptive to the husband goes, oh, it's that whole thing of leading by example. I'm going to get on board with this. I want to be my best version of myself. Emotional readiness. I don't think the men are ever ready. The women are always ready. The women are always ready.
Chinese medicine, acupuncture, there are so many uses for these things. What inspired you to focus on women's reproductive health? Because you could have taken these tools and done anything else with it. So many things to do.
Yeah. What was happening? See, I really wanted to work in fitness and sports excellence, only because I had that background. I was a state gymnast. I played basketball, volleyball, I played lots of team sports, and I was just okay. And then I was a dancer as well. So I really wanted to work with elite sports people. And I started that. I started working with elite sports people, Olympic swimmers, runners, bodybuilders, you name it. I loved it. And then what was happening is hormonally, I was always having to correct things. It would always came back to their fertility. their periods, their hormones out of whack. When you're at that elite level, there are a lot of imbalance. The body will prioritize their performance over their hormones. So I would correct things in their time off, or if they wanted to have children. So it was just, I was pushed in that direction. And I was just genuinely good at it. And the hormone side of things, like I have a lot of my colleagues saying, I don't know how you deal with it. The emotional breakdowns, like it's a lot of disappointment. And I can hold that space. I don't know why. I think my peak performance patients taught me about resilience and never giving up. And I've taken those tools and applied it to the fertility niche. And that's where I've landed.
Is there a part of you that still wishes you were working with sports people and athletes?
Yeah. When an athlete does cross my path, I'm like, oh, I had Alicia Gowan. She's a world champion bodybuilder. And I was like, oh my gosh, it was beautiful to work with her. And I love people that are excellent at what they do and in an elite in their profession, because they're so disciplined in doing the work when they're working with fertility. And that does happen. And I really enjoy that. It's a little bit of people watching on the side. Yeah. So it still does cross my path. I still work with elite athletes. Yeah.
We talked about so many things. Can you walk us through your typical consultation process for a patient who's seeking fertility issues, and what can they expect when they're going through this?
Yeah, so when people come to see me, often they come to see me, it's a last resort. I wish it was always the first step, but it's usually the last resort. They've tried everything else. They may have tried rounds and rounds of IVF and IUIs and lots of failure. So I love that. This is where Chinese medicine shines. That I love it when people say there's no hope. And I'm like, there's always hope. Because I love when you can get the body ready, the miracles start to happen. And I get to watch miracles every day. And really, it's just a shift. It's that shift. Can you make the changes? Because it takes courage to change. So when they come to me, there's usually a lot of failure and disappointment. So I go, all right, let's get the base markers in. I want to know your blood ZAR, your hormonal panel. I want to do a pelvic ultrasound. I want to see a semen analysis. So we get all the data first. And then they'll fill out a massive intake form. Usually takes about an hour to fill that out. And then so it's a comprehensive form that will tell me so much about them, from how they go to sleep. Is there anxiety in their chest? What's their digestion like? I ask them all these really strange questions, but Chinese medicine, we decipher all this information and it gives us a differential diagnosis. So by your intake form, I've got a pretty good understanding of what your diagnosis is just by you filling out the intake form. And then in the consultation, right, then we get to work, right? Then I teach them about tongue diagnosis. So the second follow-up is like, we get the tongue picks with the sublingual veins, and we teach them all about themselves. And when I can start to show them how to read their tongue, they become tongue experts. They learn all about Chinese medicine. I'm very transparent. Like, one thing about me is that I don't hide what's in my hoops. Everything is documented. You can actually look it up on meandchi.com and you can go, whoa, she's put this herb in this formulation. I want you to be educated, all right? Full transparency. Chinese medicine, when I first started, was very closed. It was like the practitioner kept all the knowledge, whereas I wear my heart on my sleeve because I want you to be empowered with this knowledge and then share the love of Chinese medicine and share it in your community, because it's the gift that keeps on giving. It has in my life. And so I like to empower my patients to know Chinese medicine inside out. So they get to learn. So it's a process of learning along the way. And then it's the coaching. So I do coaching. I usually do hourly consults, and we go through all of the things where they're falling down, the reframe, if it's cognitive, if it's a physical issue or an intimacy issue. Not every consult's the same. I don't think I've ever done one consult the same or one formula. Prescription, the same. Everyone's unique.
What advice would you give to a woman who's feeling very exhausted and thinks that she has gone through all her options and thinks that there is no way out?
I would say give yourself time to find the right fit for you, whether it's Chinese medicine, but having a support around you. If you're exhausted, let's even start with a massage. Let's start to take a step back and just go, all right, can I pull in a nutritionist, even if it's not Chinese medicine? How can I actually bring more nourishment into my life? Can I actually download Insight Timer or the Calm app, and let's do some meditation? You can really start the basics. You can get started. And then I would start to say, all right, what is my cycle? Is it regular? Is it not regular? If it's not regular, how do we make it regular? You could try acupuncture. Brilliant. Brilliant for regulating the cycle. So we want to we want to make sure that you're ovulating. We want to make sure that you've got a regular cycle. We want to make sure you don't have a painful period. So if there's pain, it's like, warning bell, could be endometriosis. Warning bell, periods are not meant to be painful. And if your doctor's telling you period pain is normal, then that's a red flag. All right. That's a red flag for you to go, let's start with maybe some acupuncture, some Chinese medicine. Let's get the diet right. We want to fix that pain. It's all about your period. So remember, your period is your fifth vital sign. So look at your period. What's it showing you? Is there clots? Is there pain? Is there light flow, heavy flow? Often if there's a really heavy flow, it can be estrogen dominance. My advice to women out there that might be just feeling, oh, there's no hope, but there's always hope. And the body's intelligence, this is what I say to my patients. It's incredible. When you start to get the nourishment, the body changes very quickly. Miracles can happen in 2 to 3 weeks. Sometimes they can happen in a session, in one session. I witness it all the time. Change is possible. So it's about being prepared to be the change. It takes courage. And it doesn't have to roar, it can whisper.
Fiona, in a world where we are ruled by big pharma and all these interventions and practices that are really geared more towards financial interests instead of human interest, proper healthcare, someone like you getting out there, providing service to couples, be able to start their family, grow their family, it's incredible, it's invaluable. Not only that, you are using Chinese medicine that's 5,000 years old and using ancient, safer techniques that don't sometimes use strong pharmaceuticals and cutting people open to be able to bring joy to people's lives. You're open, you're honest, and the personality that you have is just warm and you're always smiling. And I can only imagine how wonderful it is for those who are struggling with fertility, struggling to grow their family. They walk into your office, they walk into your clinic, they do an online consultation with you, and they bring all this stress on their back and they talk to you for a little bit and they feel better. And then they have a proven path that you have laid down that gives them results in such a short time. It's an honor and a pleasure talking to you. Thank you for being on the show. Any last words for our audience members?
Yes, I've got a tattoo on my arm and I love this. My husband has it on the left side. I've got it on the left. He's got it on the right. It's in Italian. My husband's Italian. And it says, Crederci sempre e rendersi mai, which means always believe and never give up. So always believe, never give up on your dreams. Keep going.
Love it. Thank you so much, Fiona. I hope to talk to you soon.
Thank you, Mark. It's been a pleasure.